Everybody, and welcome to this Global Government Forum webinar looking at early intervention and how the UK public sector can work together to unlock prevention. My name is Richard Johnston, and I'm the Executive Editor of Global Government Forum, which is focused on bringing together public and civil servants from around the world to share best practice. And today we're delighted to be joined by Iron Mountain as the knowledge partner for today's webinar. And it's a webinar on a very interesting and I think pertinent topic. Many civil servants and indeed wider public servants in the UK, and I'm sure many people watching along today, will agree on the potential for early intervention in public services, the ability to bring together different parts of the state to work to prevent problems from occurring or to tackle them head on when they first do appear before they get worse. This early intervention strategy can be applied to many parts of public services. It can bring together services around early years to help children get the best start in life, and can also be applied to parenting and family services to make sure that assistance is provided to families when the problems first emerge, rather than waiting for them to reach a threshold for more formal intervention. But it's also an idea that's not limited to early years. It can also be applied to areas such as mental health and well-being, and areas of justice policy like antisocial behaviour. It's an area that now I think has quite a long history in the UK as an area of focus, from the kind of Total Place initiative in the 2000s to the early intervention reports under the coalition government and projects like community budgets, and even touching into things like the integrated care systems being developed in the NHS now. All this has been a focus to kind of both improve services and unlock savings from better coordination of public resources and kind of reduced demand in future. When he wrote a report for the coalition government in 2011, the then Labour MP, Graham Allen, identified what he called £17 billion of late intervention spending. So kind of intervention earlier could unlock a decent chunk of those savings. But public services, I think, have changed quite substantially from the time of some of those reports, with Brexit and COVID-19 putting many different pressures on the UK public sector. So we at Global Government wanted to bring together this panel today to take a look at what works, to share thoughts on how an early intervention and preventative approach could be more widely deployed, and what the barriers are, particularly if, as seems likely, public service funding is going to be constrained in the years ahead. And we have a great panel to discuss this topic, and I will introduce them momentarily. Before I do that, I would also like to invite you to get involved, everybody who is watching along. If you have a question or a point you would like to put to our panel, please do use the Q&A function on Zoom. You'll see it along the bottom of your screen, or possibly on the side, depending how you've set up your platform. We want to hear from you. Do let us know, what are the obstacles to early intervention as you see them? Do you think the public sector could work better together? What advice would you like from the panel to help solve your problems? Get in touch, please, with that Q&A function throughout the session, and we'll share as much information and queries with the panel as we can. And so to the panel, let me introduce them. First up, I'll introduce James Binks, the Assistant Chief Executive at Manchester City Council. James leads on all aspects of policy and strategy for the council, including Manchester's work on public service reform, taking an evidence-based approach and developing an integrated whole person, whole family approach to early help and support for those who need it. He worked on the 6 Greater Manchester devolution agreements with government in the 2010s, including the development of a £450 million transformation fund for investment in health and social care. And prior to his time at Manchester, was previously an advisor in the Treasury, where he led that Total Place whole area approach that I mentioned, and advised ministers on a host of projects within the productivity and reform team. So it's great to have you with us, James. Welcome along.
Thanks, Richard. Thanks for the introduction.
Also joining us today, we have Grace Pollard, the Senior Policy Researcher at the New Local think tank. At New Local, which is an independent think tank and network of councils, Grace has led on developing the evidence base for community power, looking at the impact that boosting the community, the power of local communities could have in the public sector. She is currently working on a research project looking at community power and the NHS, exploring the role of communities in helping to develop more preventative healthcare systems, which I think we might hear a little bit more about shortly. So welcome, Grace, and thank you for joining.
Thanks so much, Richard.
Also with us today, we're delighted to have Andrew Kerr, the Chief Executive Officer at Edinburgh, City of Edinburgh Council. Andrew began his local government career with Falkirk District Council, and in his 38-year career has been the Chief Executive at 4 major local authorities in North Tyneside, Wiltshire, Cornwall, and his current job in Edinburgh since July 2015. He's also the Scottish trustee on the UK board of the National Society for the Prevention of Cruelty to Children, so has a lot of expertise to bring to our conversation today. And good afternoon, Andrew.
Yeah, good afternoon. Hi.
We're also joined by Alice Blogg from the Partner and Programmes UK Public Sector team at our Knowledge partner Iron Mountain. Alice spent 7 years specialising in delivering information solutions for the public sector at Iron Mountain, with a particular emphasis on local government. She is passionate about improving public services through driving process efficiencies which free up capacity to focus on more complex tasks, which I think is an excellent perspective through which to discuss today's topic. So welcome, Alice.
Thanks very much.
And last but by no means least, we are joined by Jo Faines, the Head of Research at place-based think tank Localis. Jo has been the Head of Research for 4 years, overseeing more than 20 policy reports and a wide range of other publications. And Jo's work on local economies and labour markets has been featured in The Guardian, The Financial Times and Sky News, among others. So great to have you here too, Jo. Welcome.
Thank you.
So it's a great panel to discuss this topic, and just another reminder that if you do want to put any questions or queries to them, please do get in touch using that Q&A button. And yeah, many thanks to all of our panel for joining today. So firstly, I'm going to ask James to set out some details of Manchester's work in this area. James, over to you.
Thanks, Richard. If we go to the next slide, please, Alexa. So I'll start with the vision for Manchester, and as many of you know, Manchester is a very ambitious and dynamic city. It's also very diverse. We've got over 200 languages spoken. When we developed our strategy for the city, we set the ambition of being in the top flight of world-class cities. And in terms of what that meant, we developed the 5 themes you can see in the box on the right-hand side of this slide. So we've been very successful as a city in many ways. The population has grown hugely over the last 20 years, from just over 400,000 people to approaching 600,000 today. We've had big increases in the number of jobs in the city, businesses in the city, and in the last few months we've seen a really positive pickup in the economic recovery from the COVID pandemic. But in common with other large cities in the UK, Manchester's also got really big challenges, particularly around inclusion, inclusive growth going forwards, and tackling deprivation. So just to give you a sense of the scale, Manchester's ranked 6th nationally in terms of the IMD of deprivation. We've got over 40% of our children, unfortunately, growing up in poverty, and around a quarter of the residents who work in Manchester paid less than the real living wage last year. So we've got a really ambitious strategy, but we've got also a real focus on delivering change for our residents going forward. Next slide, please. So if the strategy is what we're trying to achieve, this is how we go about it. We've got something called the Our Manchester approach, which has been developed for about 6 years now, since 2016. And we take all our staff through something called the Our Manchester experience, which is an immersive learning experience where people learn about how to apply the approach to their area of work. The diagram on the left-hand side shows the kind of common principles that we have around how we work in the city. So it starts at the top from Better Lives. Everything that we do is about the people of Manchester. We really focus heavily on listening and trying to understand the issues that are really important in people's lives, rather than telling people just about the services that we offer. We recognise the strengths and the assets that there are in our different communities and diversity that I mentioned before, and we work together with our partners to make the change happen. On the right-hand side, public service reform in Manchester has got a history of working for about 10 or 12 years now. We very much start from an understanding of the whole person, the whole family, what are the different issues going on in their lives at any moment. We think about where intensive support may be needed. Not everybody needs more intensive support, but some people certainly do. We placed a high premium on evidence and evaluation, which is the theme really of what I'm going to talk about in the next few minutes, about making sure we can evidence why are we taking the approach that we are, for which people, and what's the impact it's actually having. And then we also do a lot of work with our partners about resources and how can we bring resources together from a range of partners to be able to work on some shared priorities. We don't think we're going to get everything right from the start, so there's also a big emphasis on learning as we go, making iterative improvements, designing and testing as we make progress. Next slide, please. So I've now got 3 examples of how we apply early help to different parts of our business. And the first one is around children and families services, where we've got 3 early help hubs in the city in North, Central and South Manchester. And each of those is home to a number of key workers who provide intensive support for families and children, different levels, as I mentioned before. This is much more advanced and much more detailed than national programmes like Troubled Families Now Supporting Families. We get about 1/3 of the funding involved from that, but we provide around 2/3 of it ourselves. And we also get huge contributions from partners who actually do 50+% of the early help assessments to behind this themselves. I mentioned evidence before, so we've got a strong focus on evaluation of this programme. If you look at the chart, we measure progress against a series of different outcome measures along the bottom axis of the chart. We look at the blue bars for how many of the families that we work with had that issue before intervention, and the orange bars show how it changed after intervention. We measured that 12 months after the period of support has ended as well, and we also compare to a comparison group who are not getting this same level of support. So just going to illustrate that with a few examples from the chart. If you look at the red number 1, this is the proportion of families that had a child in need status before support, which was around the 30% mark, and it was used to just 5% afterwards. So that's an 83% impact from the intervention. The second one is about unauthorised absence from school, which started off at about 52% of the families and ended up at around 7%. And the third one is police call-outs, which is really important for our police partners. 60% had a call-out beforehand, that reduced to 35% afterwards. And there are similar examples from some of the other measures in that chart. And this has been really important in developing not just an early help approach for children's services, but also making sure that that can then be translated into other parts of how we work in the council. So next slide, please, is about adult services. So we've got a transformation programme called Better Outcomes, Better Lives, which is led by our local care organisation, which brings together community health and social care into different neighbourhood teams across the city. Again, we've applied that strengths-based approach, but how does that actually work through social work practice and leadership? So the things that social workers do around assessment and support planning for individuals. And we've done a lot of work in the background of our social workers, things like communities of practice and the support that they need themselves in a professional capacity to apply this way of working. And just to give a few examples of the impact that we've had, we do measure both qualitative and quantitative. So we've now got around 650 additional people benefiting from reablement, and on average around 57% of those need no further care afterwards. We've also seen a reduction in home care demand in the last year by around 8%. And there have been some really important pieces of work we've done through this programme that I'm talking about, which has helped to deliver all of that. Next slide, please. So those are some of the programmes of reform, but we also try to then bring that together at a neighbourhood basis in Manchester. So the map that you can see there is the City of Manchester local authority area. We split the city into 13 neighbourhoods, which are just a tool by which we coordinate support with our partners. And as I say, we bring together integrated neighbourhood teams who work on the basis of those places. We also supplement that with data and intelligence to understand what the issues are in those places and what type of support is needed. And then we have something called a team around the neighbourhood, where all of the key partners get together in each of the 13 neighbourhoods and work together on 2 or 3 real priority areas for them collectively. So we have now got an additional early help offer operating in 3 of those neighbourhoods, and we're going to expand that out to other parts of the city. And that's particularly focused on adults in households without children, which is a bit of a gap that we had previously. But we're also going to be evidencing the impact similar to the children's model that I mentioned. Final slide for me Just wanted to finish with some reflections for policymakers. On the left-hand side, some of the success factors. The top one really is critical that this is about the people, both the staff and the residents. So it's really about how we engage throughout the whole journey and develop this with them, engage throughout, and co-produce the solutions with the people who matter most in terms of our staff and our communities. The second point is really about investing for the longer term, and I think this is really important with all types of early help. That children's example I mentioned, we were under significant pressure with our budgets, as were many councils during the 2010s. We'd also had an inadequate Ofsted inspection in 2014. It improved gradually to requires improvement in 2017, and we had the good news a couple of months ago that we're now rated good for children's services by Ofsted. And the early help support has been a really, really important part of that improvement journey that we've seen in children. So there have been times over that period of time when it has been really difficult for us to sustain this way of working, given the challenges we've faced, both in terms of quality and outcomes and also funding. But we've been able to hold our nerve and back ourselves with the evidence and evaluation that I mentioned before. And just a few points on the right-hand side. So similarly, picking up some of the difficulties we've faced, I think the challenges of investing for the longer term, and obviously early intervention often takes a significant period of time to realise a return, particularly when we in English local authorities have very short-term funding settlements, often of just 1 year, at best 2 to 3 years, coupled with the challenges of actually reducing funding in many different waves over the period since 2010. And that not just been the case for us in local government, but also for many of our partners, the NHS, the police, housing providers and others, who've also faced some significant funding cuts, and we've had to really hold our nerve about investing for the long term. So I think that's my 5 minutes, and I'll hand over to the next person. Thank you.
Great, James, thank you very much. That's really interesting. Those reflections there at the end are a great summary of the work that Manchester has been doing. I particularly think the evaluation and evidence base part of this work is particularly interesting. One of the issues that I think came up around some of the troubled families work that was run or had more central dictation to it from the UK government in the coalition years was the difficulty of that evaluation and finding out that which policies, which interventions had worked, and kind of disassociating it from wider environmental factors. So I think that the work you're doing there on the evidence base sounds absolutely fascinating. Really good presentation. And just to say, we will make these slides available as well. So everybody is watching at home, if you didn't have time to jot all this down, we will provide it in both the report of the webinar and the recording that will be made available shortly. Next, I'm going to ask Grace for her thoughts on how the public sector can work together on prevention. Grace.
Thank you, Richard. So as you mentioned, at New Local, we're a think tank, so with our research, policy and practice work, but also a network, mostly of local government. So we do a lot of peer learning with councils about how to tackle some of these challenges. Our work at New Local increasingly focuses on this idea of community power. So today I just want to speak a little bit about why we think community power is important around thinking about prevention and early intervention in the public sector, and also to draw a little bit on some of the reflections from a report that we have coming out this summer about community power in the context of the NHS. So first, for people not familiar with it, what is community power? What am I talking about? So at New Local, we understand community power as being based on the principle that communities themselves have valuable insights into their own circumstances and what they need to thrive. And so building on this, it's important that communities have a say over the places they live and the services that they use. So what does that mean in terms of the public sector? Well, it means that institutions need to be capable of working alongside communities, listening to them and involving them in decision making, responding to their insights and investing in them so that they can participate in building good places to live and services that work well for people. And this isn't just a theoretical idea. So community power is a principle that's already been translated into practice in parts of the public sector. We see this particularly in local government in many of the councils in our network, but also increasingly interesting examples of this principle kind of inspiring work in the NHS as well. So our policy research, practice and peer learning is very much focused around how community power is being put into practice in public institutions, how they're working with communities both of interest and place. And a strong theme that often comes out within this work is working with communities in order to drive a more sort of local system focus on prevention. So I guess when I got asked to speak on this, prevention is a really broad topic, prevention, early intervention. I'm sure as we're going to hear today, there's kind of lots of different angles we could focus in on. But I think in our work, we try to think about two big areas. Firstly, on the one hand, prevention and early intervention, much more focused on what services are doing. But the other aspect that I wanted to bring in is about that more upstream prevention. So what's happening out in communities and what's the role in the public sector in supporting that. So if we take, for example, health inequalities as a good example around this. So that's a big focus for us in our forthcoming report on the NHS. And you can look at health inequalities both from the perspective of what services are doing to respond to reduce inequalities, but also that much bigger role that the public sector is thinking through around the role of working with communities upstream, particularly addressing social determinants of health. I think that's a good example to illustrate it. The big focus really in our work is around the need for communities, people and communities, to be active participants in this broad framing of prevention that we've set out. The idea that this can't just be something that services do or deliver, but needs to be something that deeply involves communities. So to illustrate a little bit more what I mean, I wanted to draw out 3 principles that we're setting out in our forthcoming report and that really underpin a lot of what we're seeing from parts of the public sector that are starting to take these ideas very seriously. And in terms of how that is sort of inspiring thinking around moving towards more preventative services and more preventative local systems. I think it's important to emphasise from the start that we tend to talk about community power as a principle for the reason that what we are seeing is this is not really an approach that's just being, it's not just a toolkit or one approach that's just being picked up from one place and dropped down into another. What we're really seeing is this principle kind of taking hold in bits of the public sector and in the sort of aspirations, priorities and challenges in particular places, communities and services. So places very much making this idea their own. But that said, there are sort of 3 principles that we increasingly see as really underpinning the practice of this in the public sector. So I just want to briefly touch on these here. So the first one is around community participation in decision making. So that's both at like a strategic and at service level. And it's really about that idea of how people and communities' voices are being brought into public services and into the public sector. And there'll be approaches here that you're quite familiar with, whether that be sort of long-term approaches around co-production. And then also increasingly we're seeing in councils real use of deliberative and participatory tools and some use of that in the NHS as well, from things like citizens' assemblies, which are quite high profile, through to councils starting to really think about how they can have like ongoing conversations with their communities. And I guess that's about, in terms of the big strategic decision making, it's about understanding people and communities' priorities, challenges, and insights into how some of those challenges can be solved. From a more service design and delivery angle, it's about ensuring that by working with people, we can make services more accessible, capable of understanding the challenges that people are facing, able to respond in a more holistic way, joining up services, but also connecting out into those wider networks of support in communities. That's perhaps the bit that's not so much seen. So that links to the second principle, which is around mobilizing community assets. And what that really means is how, not what's happening in services, but what role the public sector is playing and what's happening out in communities. And I guess what we often see in practice here, both in the NHS and in local government, is this sort of taking of an asset-based community development approach. And for a long phrase, that's really about, how you're supporting, enabling, connecting up networks, groups, social infrastructure in communities. So it's about looking out of services to what's happening in communities to support people to live well. It's also about community-led responses to some of these big prevention challenges and about how working with communities can help shift this focus towards more upstream prevention. And then the final area I wanted to talk about, and we increasingly see this as an important area in our work, is that organisations really sort of seriously adopting these ideas have a big focus on the culture change internally that needs to underpin this. So we talk about the idea of a community-focused organisational culture. And I guess that's fundamental to supporting the practice of the first 2 principles. It's fundamental to sort of understanding what your communities need and what their priorities are, using that to kind of drive a shared sense of mission between public services. I think something that really strongly came out during the pandemic. But it's also about some of the things that James touched upon around like strengths and asset-based ways of working, moving away from more hierarchical to more partnership ways of working, both with communities, voluntary community sector, wider set of partners. And also critically enabling people who are working in more frontline roles, giving them the permission to work in this way and the support to work in this way. So I hope those principles give you a little bit of a sense of some of the work that's guiding our thinking at New Local at the moment. I'd very much say that they are, they're a starting point for a bit of a growing conversation around this. So it's something I'd be really interested to hear people's thoughts on today. So thanks.
Great, thank you very much, Grace. That's really interesting. I find the points around culture and organisational culture in areas like this to be absolutely fascinating. I'm a policy geek, and I always look at processes and things like that as my starting point. And the more I do this job, I grow to realise that actually it's the culture that matters more than the policies and the processes, as much as I might like the writing something on paper to be the way to fix it. That's a fascinating contribution. Thank you very much. We're going to move to Andrew next to get his perspective from Edinburgh. Andrew.
Yeah, thanks, Richard. And I apologise to those in the audience who would normally have difficulty understanding my Scottish accent, but combination of throat infection and watching the Eagles last night has affected my throat as well. So hopefully you can understand me. I was going to start with opportunity, really. I think we're talking about this prevention agenda, and one of the reasons I was really interested in speaking at this seminar was it feels to me like we've got an opportunity, maybe a once in a generation opportunity, to reset how we go about work in public sector. The opportunity that we got from having to respond to a global pandemic, and perhaps even now to the crisis around the Ukraine, meant that we've managed to build on partnerships which were there but are now much more intensive. We managed to use emergency powers, which allowed us to go around the inherent bureaucracy in the system. We managed to get trust with our communities and our third sector partners, and community empowerment are right at the heart of almost everything we did right at the beginning of the pandemic. Food banks, etc., are a really good example of those things that we created almost instantly to allow people to survive what at the time was a horrendous situation, and to some extent still is. And if you look at the history of the place, where there's been a number of experiments in this, and I was interested to say that James was saying that Manchester have managed to keep going since 2010. Well, I also did quite a bit on Total Place as well, James, which was absolutely the right idea. Put all the money together in the public sector, make it work more efficiently, make it work more effectively. But in fact fell apart because of the institutional needs of keeping their own budgets and pressure on resources, etc., etc., had that effect. But devolution of power, the Wigan model of community empowerment, family intervention, social capital, happiness, all of those things have been part of government intervention over the last 20, 25 years. What we haven't done is sustain them over that period of time, or even gone back to them when it's most appropriate. And maybe now, I'm arguing, is the time where we should use the fact that we've been in a really horrendous place to get better public service and a better approach to public service as we go, which builds on that which was already there. So what's new? First thing we've got to do is not replace the barriers that were put up, were there before. I think as a chief executive, I know for a fact, silliness, that I had 978 emergency decisions made that I would normally have had to go to committee for in my council, that I just made instantly to allow us to get through the pandemic, etc. That kind of flexibility, and not so much about my benign dictatorship, but about that kind of flexibility you should have for in public service is really clear. Partnership working. I now continue with an informal chief executives meeting every Friday afternoon, all the public sector partners, the universities, chancellors, etc., who sit around and we chew the fat about what we're going to do next for the community. And it's not got an agenda, but it is about thinking through how we work better with our communities. In Edinburgh, we're using a thing called, that some of you will be aware of, called 3 conversations. So our approach to almost everything is about asking someone question 1, which is, what do we need to do to make your life better? This isn't before we think about a care package, before we think about intervention, before we think about helping. Secondly, if you do need those things, then what can we do to help you get those things? And then only then do you come to the third conversation, which is about, okay, If none of those are working well enough, we will think about things like care packages. And a number of authorities in England and Scotland are experimenting with that kind of approach. We think, and I think we can prove in the short term, we think we've saved about 1/3 of our social care costs just by doing that, because we aren't giving out so many packages automatically, either from hospital or from social care, and that's been a big improvement in those things. And then the last thing is about continue to think about ways in which you put resources together. We have a thing called IGB boards, which is really health and social care, just putting their resources in one place, managed through an independent organisation. There's versions of that all over England in different ways. But that allows you to think about health and social care as a whole, and not just about acute and not just about care and separate. And the last thing to say is we're trying to design must play a part in how we deal with prevention. If you design your neighbourhoods, design your bits of your city so that you are able to walk to or easily get to the services you need, the lifestyle you might want, the healthy lifestyle you might want, then it's going to make life a lot easier. So designing cities is a really important part of that. Government's got to stop dealing with the symptoms, in my view, and start dealing with the core problems. And all of us will know here that what the local authorities or with government, that it's difficult to do that when you've got 5-year political cycles running about. Getting somebody to think about 15, 20 years further ahead and think that I might not even be there is quite a difficult thing to get politicians to get in that space. But we've got to start thinking that homelessness is not about a lack of housing or even mental health. It's about preventing a lack of housing, preventing a lack of mental health, and preventing mental health problems. Delayed discharges is not about people turning up at A&E and not being able to get out of hospital. It's about community health and keeping people healthier. Poverty is about people's access to what they've got right, but also improving their lives so that they are able to live with slightly less money, but actually think about poverty as a whole and prevent things like making sure things like education standards, etc., are fair and equal and delivered right across the community. So to do that, however, if we're going to persuade politicians and continue to persuade politicians, unless you're very lucky where you've got a single party and a single party in charge, James, I must have had something like 7 or 8 different political parties in charge of the places I've been in. Unless you're lucky in that way, and it's luck, it's good that you've got them. I think a single party gives clarity. You need to be able to persuade politicians, policymakers, that there is clarity of outcomes that can be achieved, and then you can prove that those outcomes can be achieved, which is what we're trying to do through the 3 conversations model. And James very obviously did in the slide he used with the different outcomes right across the board by acting in a certain way. And if we're able to do that, then perhaps we can move to a more preventative model, which actually values putting resources in upfront, upstream, to stop the things that we all deal with as symptoms, which is people sitting in our streets, people in poverty, people in ill health, and fix them. I think that's it, Richard.
Thank you very much, Andrew. Really interesting and indeed hopeful contribution that this might be a moment for change that can catalyse the kind of reforms that we're talking about today. And I'm just to mark the rest of the panel's card, I'm keen to come back to them when we get to the question and answer session of the of today's webinar, to see if that hope that because of what we went through in COVID, we can kind of build greater preventative services is something that they share. I think that's a very interesting and indeed hopeful point we will return to. I'm now going to ask Alice to share her perspective and Iron Mountain's perspective.
Hi, thanks. Yeah. So kind of as I was expecting, it's been really interesting. Obviously, I come at this inevitably from a slightly different angle as a knowledge partner, but also a supplier to the public sector. And just briefly, for anybody in the audience who isn't aware of Iron Mountain, to just give a bit of context about who we are. Historically, we've stored hard copy records for many public and private sector organisations. And more recently, we've moved into an increasingly digital and consultancy-led areas of information management. So ours is very much the broader information management take on this. You know, as I say, inevitably we're seeing it rather than from the way that services are design led, what sort of interventions and that sort of thing. We're coming at it from that sort of angle. And I thought it was a really interesting topic for a webinar because you know, we know that early intervention has been proven to reduce workload and costs for public services, as well as improving outcomes for citizens. And it's really interesting to hear the kind of case studies about where that's been the case, and the dramatic levels of savings that can be achieved, as well as I say, the kind of critical improving outcomes as well. But from our perspective, you know, the information which underpins a lot of public services and managing it does continue to be a significant challenge, sometimes in ways that can really be quite easily addressed. And what I've tried to sort of think about is general principles of this, and, you know, taking a step back from even specifically what we do. There's sort of a more obvious example of that would be that information continues often, surprisingly, to be to exist in hard copy format, even when it's being used on a day-to-day basis, which makes it very slow to share and to search. Often a lot of information is still sitting out there on a range of quite old systems, which can make it hard to share or access information internally within an organization, let alone across organizations, which I think everybody is aware is critical to delivering early interventions. I know that interoperability has become a bit of a buzzword of late, but it is the core enabling in many ways, one of the core enablers of early intervention, because if different organizations that need to get a view of an individual or a situation or a project can all access that appropriate information in a timely way, it significantly improves the chances of being able to spot things early, of being able to spot patterns. And I'll comment a little bit more about that in a second in terms of, you know, some of the other resources that can be used to address that, but you know, it is critical. Without that complete picture, it's very difficult to deliver robust services at all, let alone coordinate them across different parts of an organization or different organizations that are looking after different aspects of that. So I thought I'd just run through a summary from our perspective of what, you know, we feel potentially holds the public sector back from achieving the kind of information management which would enable that interoperability, and through that the ability to better coordinate early intervention programs. The first, as I've mentioned, is that paper is still out there, and that's not optimal, you know, increasingly not optimal, obviously post-COVID, you know, really not optimal. People are more spread out than ever, and that's just going to continue that trend. That genie is not going back in the bottle, and I think most of us are pretty glad about that. And obviously that when you've got paper involved and you've got digital systems of information, you inevitably have a kind of hybrid system, which sometimes is by design, but mostly is by default. So you either have, you know, you tend to end up with a bit of both. Old systems, again, I think most organizations are, you know, familiar with the fact that there have been some very long-term contracts in place for managing legacy, for managing information, and those are not always optimal. It's difficult to get data off them. It's difficult to interrogate that data. It's very difficult to get those systems to talk to other systems, with that, I would say one of the other major challenges is fragmentation across the public sector. So lots of different types of systems in place for different types of things. Lots of, you know, local individual organizations doing things in a different way from their immediate neighbors, which again makes it more difficult to join things up, because obviously when you were talking about early intervention, while people may stay locally, they also move between areas, and they may move, you know, quite nearby. And if the minute they do that, the whole picture is lost and you're starting from scratch, you're immediately losing all those advantages that having a more joined up approach within at least regions would create. I sometimes also think, and it's always a bit contentious to say this when you're coming from outside the public sector, but I sometimes think there's a lack of belief that it's possible to get to what good could look like. You know, sometimes there's I think a feeling of it's, you know, there's been so much constraint on budgets, there's been so much constraint on resources, people are kind of trying to muddle through with what they've got, and you've always got to kind of, you know, there's a vision of where you're going, but that real belief that it could, you know, that you can make some of these changes, that can be hard to get across. I mean, we're talking about culture just now, and I think that is a real, you know, being honest, that is a real phenomenon that's out there. So from our perspective, what could be done to improve the way information is managed in the sector? Intelligent digitization, so getting away from paper as much as possible, not digitizing everything, but weaving ongoing digitization into ways of working by design rather than by chance. Thinking big in terms of workflow automation, so rather than you know, having maybe just something that automates what you do within a particular quite small set of processes, actually thinking, well, where, you know, if we really joined this up, this is what I mean again about the sort of mentality, if we really joined this up, what would good look like? What would be really fantastic? And how can we map that out and get as close to that as possible? Because as technology is developing, the tools that are enabling people to make those kinds of changes are, you know, they're becoming more and more attainable. And less of a kind of, you know, rare bird that, you know, some people are able to access for one reason or another, but most organizations aren't going to be able to aspire to that sort of thing. So I think thinking big in those terms is really important. Standardization, you know, there really is no substitute for agreeing on a small number of standard providers for services. And I know that the dangers of that are that, you know, if something goes wrong or if something doesn't turn out to be suitable for, you know, fit for purpose, a lot of people are then using it. But there is very significant advantages to be gained from minimizing that fragmentation and adopting standard, you know, standard ways of doing things across and between geographies. And as I say, I think there is a mentality, a kind of that it would be good to address around, you know, and I think it was great to hear the case studies from, you know, some of the stuff that Manchester have managed to achieve, some of the things that Edinburgh have achieved, and the work that Localis do in bringing local government together to share these things, because I think sharing successful pilots and real improved outcomes where costs have been reduced and outcomes have been improved, that, you know, there is no substitute for doing that. And the final thing I would add is that, you know, I know, again, slight buzzwords, AI and ML, machine learning, and automated intelligence. Again, these tools are becoming more and more accessible outside the realms of you know, high-end research, and more applicable. We've done a couple of projects recently with government departments where we're using some of these tools to enable information to be far more searchable, digitized, and then far more searchable than it ever has been before. And again, in terms of looking for trends, in terms of analyzing data across a region, in terms of spotting, you know, this type of situation is likely to turn into this type of situation, being able to make the most of the information you've got using tools like that, you know, that is going to be a big part of the future of planning these services. And that's it from me. I'll pass over to the next person.
Great, thanks, Alice. I think what you say about believing that change is possible is a really interesting one that links to what Andrew was saying about the kind of possibilities of this moment. So I think we will return to that shortly. But before we get to the question and answer section of our webinar, and please do keep your questions coming in. I'm seeing people posting comments and questions already. I'm going to ask Joe to give his thoughts and maybe help us believe what's possible.
Thanks, Richard. The thing about going last is I just sort of started enjoying the webinar and then remembered I actually have to say something. So for my contribution to the discussion, I'm going to be focusing on the broader social aspect of upstream prevention, you know, which is very much the context in which early intervention projects exist. So I'm going to cover how that ties in with local government discretionary service funding and why I think that's been rather lost in the current debate around the ubiquitous levelling up. And really, I want to think about how we can maybe get local public services and their vital role in prevention back into the centre of the conversation around the role of local government. Because the story of the last decade or so, and you know, this has been alluded to already in local government, has been one of a gradual shift away from discretionary services and towards delivering a core service offer as a direct function of austerity. So you see public health budgets getting cut and community outreach teams getting smaller and smaller. But that's really only one part of the story when it comes to prevention. The other part is the degradation of those public services, which raise our quality of life, improve mental health, and reduce crime, amongst other benefits for upstream prevention. You know, we know that access to green space improves the development of children in urban areas. We know that well-designed sports programs reduce antisocial behaviour and crime. It's the degradation of these discretionary services alongside cuts to core services that has really combined to limit the ability of councils to act as an agency of prevention in society. Because prevention in the broad sense is often a matter of public services, it's a matter of society, you know, youth clubs, well-maintained parks, being able to provide high quality, accessible and free facilities for young people. This is the social infrastructure of place, the spaces where local social life happens, and it's where upstream prevention can be really valuable in improving lives and taking pressure off the NHS, the criminal justice system, and indeed councils themselves. Later on down the line, you know, your core statutory services, things like children's social care, in many cases, they come in where it's too late for prevention. You know, what you end up with is a vicious cycle that many on the call will be familiar with. You know, if you take, for example, youth violent crime in sport, we know, as I say, that providing people, particularly people from disadvantaged backgrounds, with something to do, particularly sport, is a preventative measure when it comes to crime and antisocial behaviour. And as you lose your ability to provide that service, to design it in a way that maximises opportunities for an intervention, as you cut back on these facilities, your other services, like children's social care, will be increasingly burdened. So the need to spend more money on them will mean you have even less money to spend on the provision and design of other services. So what you end up with is a kind of downward spiral where the discretionary public services get left behind. And I think that's particularly important when we think about it in the context of this current public conversation around levelling up and reducing regional inequality. You know, public services are, I think, currently undercovered by this agenda. You know, we might talk about the aesthetics of high streets. We might talk about deeply structural factors like opportunity or labour markets that take really long-term remedial policy to address, and the day-to-day public services start to fall between the cracks of, you know, big-ticket infrastructure investment and small-scale ring-fence capital injections. And the idea of looking at upstream prevention as an investment of public money gets forgotten about. And all the while, local authorities are getting bigger and bigger as we look at things like county deals, we look at the unitarizations that are happening in different parts of the country. So local authorities get more and more remote from communities as the focus becomes more and more on structural economic transformation and the simple everyday things that can be crucial to upstream prevention, parks, sports facilities, they get a bit lost in the shuffle. And that's not to say they're not mentioned in the Levelling Up white paper or that the missions don't speak to them at all. It's just that much of the debate sort of focuses on a double-sided coin of state of the town centre and the state of the labour markets, and it leaves these other seemingly more pedestrian things behind. And what's missing from all of that is local government's role as providers of the baseline of public services. And, you know, as Grace was talking about communities, when we think about prevention and the role of service design, there's so much room for co-design with communities. You know, ideally, you want to bring things back to the community who absolutely have had things done to and not with them for far too long in many policy areas, whilst also shoring up the capacity of the council so that you end up in a situation where you have communities who know their needs and the place they live in, working with councils with the capacity to employ people with expertise on how to design services and programs to maximize their preventative value and identify opportunities for early intervention. And that ultimately is a question of funding. It's who it's available to and how well targeted it is. You know, so additional funding at the moment for local government for anything beyond core statutory service is based around things like the town fund, city deals, contest-based things that are targeted at economic growth. Very welcome, but they don't answer the simple question of how you provide these services, which have tremendous value in creating the conditions for prevention and early intervention. So it's crucial, I think, that stakeholders in conversation with government recognise the need to link prevention and day-to-day public services explicitly into the democratic mandate which was given to the Levelling Up agenda in 2019, and try to place a need to improve public services as an investment in prevention of crime, prevention of mental and physical illness, etc., as key and not ancillary part of the policy programme, which would ensure that councils have the capacity, have the trained staff and long-term vision to work with communities, to work with public sector partners in designing public services that are geared towards proactive and upstream prevention. I think that should take us into the Q&A.
Absolutely great. And it does indeed. Thank you very much, Joe. Yeah, really interesting point about local authority capacity that I think has to be part of this conversation, particularly after the last 12 years or so, where that has been under a lot of pressure, to put it mildly, from financial settlements from 2010 on. As I said, I do want to ask the panel to touch on Andrew's point about the kind of possibilities of this moment and whether there is a resetting that's possible from what we've learned in the pandemic. I had planned to ask the panel whether all public sector organisations were kind of signed up to this early intervention agenda, and if the funding was available. But perhaps I will take the opportunity of Andrew's more optimistic spin to kind of look at the opportunities of the moment. I will put that to James in the first instance, if I may, because obviously Manchester's done quite a lot of this work already. Is there more that can come from the experience post-COVID, do you think? And is everybody signed up to that? Is there more impetus to it than there was before?
Thanks, Richard. Yeah, I think there is more impetus, and certainly for Manchester, we found that over the last few months, the kind of cost of living and poverty issues in the city have become more acute. So the need to connect more of our residents to the opportunities that we've got in the economy, as I put on one of the Q&A points. So there's a lot more that we need to be doing in the city. I think that there's always funding available in some form or another, whichever public service that you're involved with. But the issue is it is under intense pressure. It's under intense pressure now in terms of the COVID impacts, but also impacts of inflation and other factors on those budgets. So we have to be really clear on what is this funding actually delivering, which I think goes back to the points about evidence and evaluation. It really has helped us to be able to make the case internally within the council and with our partners that we have taken that evidence-based approach to saying early intervention is great in theory, but it's also important at a practical level to know what it's actually achieving and what it's delivering. And you know, you can always get better evaluation. You can always ask it for it to be more precise and for it to be more academically rigorous. But I think we all need to perhaps make improvements to the way in which we evaluate, so we can give ourselves more confidence that the money's been used for good purpose.
Grace, what's the kind of feeling as you pick it up from the new local network and the work that you do in terms of the mood of the moment?
Yeah, so it's been obviously very interesting from our perspective to sort of sit with members over the last few years, and we did a lot of peer learning during the pandemic to try and sort of see what was happening as the kind of crisis was evolving. I mean, I think there was a lot of optimism at one point around the sort of changing culture and practices. I think some of the things that have been picked up here, whether that is around kind of risk appetite to try working in different ways, around partnership working, and I think probably where there was in some places skepticism around the role that communities can play, I think some of that has perhaps shifted. I think the real challenge now, though, is sustaining that moment, so that learning doesn't go back, because there's now, you know, huge pressures, be that, as James mentioned, the cost of living crisis and the wider context for local government. So I think there are opportunities. We're seeing interesting things around, you know, the NHS and the sort of moment around integrated care, and people still sort of saying, well, you know, wasn't mutual aid incredibly interesting, and that was so important, be that community hubs. So I think there is a lot of interest. I think it's now what you do with that. And I would come back to James's point as well around the building the evidence base for this, the kind of moving this forward is going to be the challenge now. So it has opened up that space, but those organisations that were already quite committed to it has maybe helped accelerate that, maybe convince some that weren't. But what happens now, I think, is the challenge.
Andrew, I'll give you a chance to come back on that and perhaps to expand a little bit, because I from the conversations we have at Global Government Forum with UK public sector organisations and indeed internationally, there is a lot of appetite to embed the lessons from COVID, but there's also just kind of exhaustion somewhat in the sector that this has been an unprecedented period. Are people up for the challenge of making this real after what's been a very, very tough 2 years plus?
Yeah, I think people were right to mention capacity has been a big issue. Our inherent capacity in any organisation, you know, Manchester and ourselves are very big local authorities, but my staff are just as exhausted as anybody else's in terms of what we've been doing and how we've been doing. So we had a discussion this morning about, I have probably about 45 of my staff currently dealing with Ukrainian and refugees coming in to Edinburgh, because the vast majority of Scottish input in the Ukrainian refugees have coming through Edinburgh. I cannot maintain that as an organisation for any length of time. I've got 45 of my staff who would normally be doing their day job, doing something else, and actually having time to step back and say, okay, what don't we start doing again? I think the return to work thing is a really good example, isn't it, of how the rush to people want, you know, everybody must be back in the city centres and working, and yet everybody thinks there's a better way of flexible working, etc., that we can do so. Having the time and the effort, etc., to start thinking about what do we best do, and that especially applies to preventative work, because preventative work has a long outcome tail rather than it's not instant. You can't see, well, I've got more flexible working, so it's obviously better, isn't it? Well, actually, it might be I've got much better preventative way of working, but actually you're not going to see this for 5 years. And I think that's the big issue. My view is, given the lack of resources to do so, we've got to prioritise very, very heavily about what the biggest bang for our buck is that we get in doing this area, not try to do everything. It's all actually very worthy in terms of its outcomes. Everybody wants to do better for the population, and prevention is very obviously proven to be the best way to do it. But actually, unless you prioritise heavily, you're never going to get to a point where you can't prove either numerically or physically that you're going to do it. So yeah, capacity is the big issue, and we're struggling like everyone else to do the same thing.
I'll just ask Alice and Joe to come in quickly on that capacity point. Alice, we mentioned at the start that, you know, that the work that Iron Mountain can do in helping free capacity through kind of digitization, is that, are you having more conversations with local authorities who are looking to free up as much as they can, or change processes post-COVID?
Yeah, it's a good question. I think it's and it's interesting, again, the kind of different perspectives on this, because I think we are still, I would say, not. This is what I mean. I think there is an element of exhaustion, and I think there is an element of people just not really being always aware of the art of the possible, which is so I would say sometimes the appetite may be just about there, you know, in terms of, you know, it being a good moment to do this. But I would say that, and that's why it's good to have an opportunity to come talk at things like this, because I think sometimes people are just not aware of what, you know, what can be done, what tools are out there to allow them to optimize this, you know, some of the ways that they're working, and also some of the things that from a supplier's perspective, because, you know, you move between organizations and you get different overviews of what people are doing, how making things, you know, standardizing things, or looking at what, you know, your neighbors are doing that's actually working really well, and saying, well, why don't we do that, because inevitably we are going to have to join up. Sort of seeing how much more of that could be going on. I mean, I'm a big advocate, and I realized earlier I said localis and I meant new local, but I'm a big advocate of people sharing these stories within the sector, because I think it is the best way to improve outcomes by understanding what really works on the ground. So no, I would say I'm not seeing a big, we're seeing more of a demand for digitization that goes on and on and on. The cuts in funding that people continue to experience, and the stretched resources, mean that it's difficult for people to get their heads around, where do we kind of place our bets? Where do we decide this is going to make a sea change for our organization in terms of freeing up our capacity where we really need it? But, you know, what I would tend to say to people is examine the business cases, just, you know, have those conversations with suppliers. Don't be sort of, you know, put off by don't be put off having that conversation, because there are ideas out there that you get from working with lots of different organizations. And lots of suppliers will have experience in terms of being able to allow you to see where you could potentially save money by doing things differently, as well as educating about, you know, what the art of the possible is.
And Jay, sorry, Lost my questions. Joe, what you mentioned about the capacity crunch in local authorities, I mean, that applies as much to kind of the space that organisations have to do these kind of rethinking of the public realm, as it were, as much as to the kind of service delivery itself. Do you think people do want to revisit a lot of this stuff?
Yeah, I mean, I think the pandemic and whether or not that made anything sort of better, and Andrew's point is absolutely right. You've got to target what's going to have the most impact locally, and that's going to be different in different places. Like, for example, I live in South London. Like, to be honest, the community infrastructure was already pretty strong. The pandemic did reinforce that, but on issues of like public estate is a really good, public realm is a really good example, because I mean, you could tell from the way I kept referencing it, but where I live, crime and and young people being underserved is a huge problem, and it doesn't, nothing about communities being able to be more aware of each other and have stronger networks stops the fact that facilities that were being used for things like boxing clubs and sports are being sold off by the council. Nothing changes that. So that on that regard, I'm quite pessimistic about it. But on the other hand, you do see, particularly around things like green space in the area, I think like you've seen friends of groups really stepped up during the pandemic, and that's definitely been reinforced and more people got involved. So on that regard, I think things have really improved. So I think it depends on the service area and what kind of thing you're targeting and what you're trying to get out of it. Sometimes I'm not sure it's made a difference, but in other areas, I think the increased sort of the increased social infrastructure, if you like, has probably helped.
And we've had a couple of questions in from people watching along about the kind of community engagement elements that we've been discussing. I'll put them to Grace in the first instance, and then perhaps James and others can join in. One from Susan Fleming asking, is it not just the loudest voices that claim to represent communities? Community consensus is difficult with different groups and differing priorities, and meaningful engagement is very expensive. And we've also had a comment from Andy Ragg touching on, I think, a point that Andrew made about communities knowing what they want. Can communities really know what they want, and do people have the kind of knowledge of kind of what the public sector does or indeed can do to kind of make those choices? Grace, I think it'd be great to get your thoughts on that, and then perhaps James and anyone else that wants to come in.
Yeah, sure. Those are both great questions, and common challenges we hear with people sort of on various journeys to doing these kind of approaches. So I guess on the hearing from the loudest voices, I think in fact we were having this conversation in a session yesterday. It's about layering up different approaches. So tools like deliberation are precisely for reaching out to hearing beyond those usual voices. So it is about, you will be trying to hear from a cross-section of your communities. It's also about sort of expert facilitation in order to do that in a way that is going to be accessible to as many people. But that means those kind of approaches, they are not cheap, they are not quick. Good deliberation run well is going to be a big undertaking. But there are other things that organisations kind of at the forefront of this stuff are doing, and I think that's about all of the different layers that you're bringing in. So be that co-production with particular service users, be that reaching beyond people who aren't accessing services, how you're working with your voluntary community sector in order to reach out beyond the voices that the council are going to hear. Not everyone is going to want to engage with public services. They may have experiences that are going to make that difficult. So that's absolutely why partnership working has to be at the core of that. And I think that also speaks to that wider point around capacity building. This isn't sort of prevention that can just be done as a means of cutting back. It involves capacity building. It involves working with communities. I think in terms of that question about the knowledge, again, I'd say formal deliberative approaches will often sort of share information with people as part of the process. But we see other things going on where people are sort of talking to communities about challenges from the public sector point of view, bringing in other people so you can hear those challenges. So it's about building knowledge. And then processes like, for example, things like participatory budgeting, often where you're saying to people, though, this is about making a choice and we're going to engage with communities about what those choices are. So I think it's about what you do. I think it's about the layering. And I think, yes, it is time consuming. It is, it does involve capacity. I think the organisations we see doing this well are making this very much part of their core mission to how they work with communities, to their commitment to how they work as public services. And to James's point as well, like collecting the evidence demonstrating why it needs to be the sort of core business as usual way of working, not just things that you can kind of add on the side, I would say.
James, can you comment on how it works in Manchester?
Yeah, really agree with the points Grace has made. And it's really core part of our Manchester approach that I started with early, about taking the time to listen and understand. And it does take time, as Grace says, it takes longer to do this properly. It's also often harder for our staff, building on Andrew's points about capacity. So I think what we found is that it was useful to develop a bit of a toolkit for our staff about how to do different forms of co-production, co-design, engagement, and some examples of where that had been done really well. So just a few points on that. One is, I think you first of all need to know who you're talking to and where you need to make extra efforts. So which of the groups, which of the residents that you're hearing from, if you do need to make extra efforts, then how do you best do that? And it might be going through VCSE partners or grassroots organisations to particularly target some communities that might otherwise be underrepresented, or who find it hard to make their voice heard through a standard universal approach. Also, let's be open at the start about, are there any restrictions or parameters that we need to work within here? So is there a fixed budget for the work, for example? Is there a fixed timescale? Have some options already been ruled out? Are there strong political views from members that we need to take into consideration, so that you're clear on the start about exactly kind of what you're talking to the communities about? But I'll just finish by saying, if you do this right and you do put the time in, you're ultimately probably going to get better results from doing it, because you're going to have built something with the communities, and I'd say with the staff as well, that's more likely to work, which goes back to the evidence point.
Joe, I think you raised your hand. Do you want to come in?
Oh, only just say that, sometimes the usual suspects are doing it because the rest of us in the community are kind of assuming that they are. So, I wouldn't, it sounds, we do sort of outsource that sometimes to those few people.
Yeah, I think that's a very fair point. As a man living in Tottenham, you know who the
right,
normal
exactly.
people who are going to get engaged in the community.
Thank God they do,
Yeah, well, exactly. Andrew, do you want to come in on the community engagement point?
Just and one of the questions in the chat box as well. That part I agree with James, is you've got to keep practicing this so you get good at it. If you've got a skilled practitioner asking the right questions, you can pull out what is affecting people's life the worst, and then talk about the potential solutions to that long before you ever get to intervention from the public sector. But it needs people sitting down and having those conversations and taking time, etc. And that's time intensive, it's expensive. And then once you've got enough trust in the community, and once they trust that that's what you're trying to do, you can move on to a bit more mass participatory budgeting. Communities make their own decisions, etc. But it does take time to get trust. In Edinburgh, we've got a thing called Leith. Leith Decides, and that's Leith is the best community in Edinburgh for deciding what it wants for itself, and that's because they've been at it for years and years and years. The rest of Edinburgh are not so good at it. And it's social capital, it's trust, it's working, trusted community workers, etc., etc. And once you get that, you're able to get a much more effective preventative agenda. It takes time and trust, and that's part of the problem, isn't it? Because short-term political scales and financial scales, etc., is the thing that gets in its road.
Yes, as a former Leith resident, I can say that that is a very true point. There's a real community feel in Leith that I do miss occasion, even as a Glaswegian. I'm going to bring the session to a close very shortly. I'd just like to get some closing thoughts from the panel, and perhaps to touch on the kind of culture point that Grace raised in her opening remarks. If you have any thoughts on kind of practical steps that you would advise anybody watching along today to kind of put into their mindset when they go to work, or put into their organizational kind of strategies or thought processes to adopt a kind of early intervention approach, to get thinking more about prevention? Are there any kind of practical tips, kind of mindset, culture things that you would think would be good to share? Who shall I ask that to first? We'll go to James. We'll go to the same order as we did our opening comments, and then any closing thoughts.
Thanks, Richard. Yeah, I mean, I think it's just being clear about the culture and the values of your organisation and how early intervention fits into those, really. So I mentioned the kind of our Manchester approach at the start, and that's what we do. It's kind of in our DNA. So we've been holding on to that as our way of working, and we've got a way in which early intervention fits into that. And then, as Andrew and others have said, it's really then about ensuring that your staff can kind of work in that way and can feel comfortable doing that, and it will take time. So we've done this our Manchester experience, which takes people through the steps of how you might then apply that to what you do. So how you might apply it to adult social care, as the example I gave, or to working with homeless families, or even to back office work like finance or HR. So that's been really important for us. It's taking the staff with us on that journey, but routing everything back to the same set of consistent behaviours and values for the organisation.
Grace, I'll go to you next. Any thoughts?
Yeah, I mean, I would echo an awful lot of what James has said there, and I think we hear similar things in that space. I think, yeah, it's about the importance of listening. I think is central to that cultural point, and also the importance of this is like, as James has said, this isn't just about one team or one particular people doing community engagement. It's about how, as a whole organisation, you're giving people that permission to listen, to have those conversations they need to have, as Andrew's been talking about. So it's the investing in the skills, confidence, capacity of staff to do that, I think.
Thank you very much. Andrew, any closing thoughts?
Just add to that, I think all of those things. But I would also add, I think you have to think, where do you best apply what you've currently got to start to have the greatest effect? Because it's almost like a rolling ball down a hill. It's starting to gather trust, it starts to gather community feeling, starts to gather those type of things, and using your people who are more skilled in the right way, in a prioritized way, has got to be somewhere where we start. And maybe just building on some of the things that the community have valued during the last 2 years, where we've been in crisis. What have they valued most? Well, start there. Start with what they valued most and get on with getting more of that value into the community right across the board. Might be the right thing to do.
Thank you very much. Alice, I'll ask you for any closing remarks.
I think the practical things that I would say in terms of a mindset change and taking things away is embrace technology. Think big, believe that you can actually make significant changes, and that one citizen view that will enable other things, can be achieved. Share best practice and learn from others, because I think those, if you can join those up, you have a really good framework for delivering some of the things that the others have been talking about. And it's that behind the scenes stuff is really important for enabling this sort of thing. Yeah. Allowing you to get the most targeted approach with all of these sorts of initiatives.
Mm-hmm. Thank you very much, Alice. And Joe, finally, any closing?
Yeah, regular conversations across silos. Never underestimate the value of a good old working group. You've got to have strategy and principles, but you have to be talking to each other regularly as officers from different departments. Ideally, talking to people doing, if you're an officer, your role in other neighbouring councils and other places. That sharing of experience, best practice, and indeed common barriers is really, really important. We've found in our work.
Great, thank you very much, Joe, and thank you to everybody for joining us on this webinar today. I think that was a fascinating conversation, and I hope you did too. You will be receiving a recording of this session in the next few days, and also there'll be a report on the webinar on the Global Government Forum website within the next few weeks too. But before that, though, there's a survey that should be in your inbox right now on your thoughts on today's session, and it would really help me and the team here at Global Government Forum to make sure that we're providing the best possible content for you all, if you could fill that in. And if you have any ideas on topics you would like to see us cover in future webinars, please do put them in there too. That would make my job a lot easier. just to flag some of our upcoming webinars, this is part of a series of cross-public sector collaboration webinars that we are running. The next one of those is on the future of the office in the public sector, which will be in September. And we have other ones planned on the Public Sector Workforce Challenge and making shared services work. And we will share the details of those in that write-up, as I mentioned. And before that, our next webinar is Digital Takeoff, how governments can help SMEs make the most of tourism's revival post-COVID. And that will be on the 27th of June. I think the link to register for that webinar is in the chat. So again, thank you very much to everybody for watching along. Thank you to our panel for joining us in the session, and thank you to Iron Mountain for being our knowledge partner today. I hope you'll be able to come along to another one of our webinars soon, and please do enjoy the rest of your day. Thank you very much.
Thank you, folks.